you so much for joining us today. My name is Hannah Evans, and I work as a senior analyst here at Population Connection. I'm going to be facilitating today's discussion and hosting the panelist Q&As. And today's panel is going to center around Population Institute's recent report, which is titled Population and Climate Change Vulnerability: Understanding Current Trends to Enhance Rights and Resilience. This report assesses the different ways in which population and social dynamics intersect with climate change vulnerability, and it also highlights the benefits of integrated rights-based development strategies that are rooted in the expansion of gender equality to enhance climate resilience and adaptation around the world. We're so excited and honored to be hosting a few of the key contributors to this report today. And we look very forward to hearing more about the report, the connections made in it, and also to a lively discussion following panelist contributions. So first, we're going to be hearing an overview of the report and its key findings, and then we're going to dive into two of the community initiatives examined in the report. So our first panelist is Ms. Kathleen Mogelgaard, who is the president of Population Institute. Kathleen has extensive experience in policy analysis, research, and advocacy. She actively engages in UN climate change negotiations, representing the World Resources Institute, and was lead researcher for the UNFPA's 2019 State of the World Population Report. Kathleen is going to be presenting an overview of the reports and identifying a few of its key points. Following Kathleen will be panelist Faith Bacon, who is the Population, Environment, and Development, or PED, advisor for the NGO called Path Foundations Philippines, or PFPI. Faith has been an advocate of the population health and environment approach to community development for almost 2 decades. She's a pioneer in the field of PED and continues to help implement and manage many successful PED programs across the Philippines. And last but not least, our third and final panelist is Ms. Kelley Dennings, who is the Population and Sustainability Campaigner at the Center for Biological Diversity. Kelley spearheads advocacy and outreach efforts at the center, focusing on the intersections of reproductive health, sustainable consumption, and climate and extinction challenges. This includes the center's popular program, which many of you may have heard of, with endangered species condoms. Kelley is going to be sharing some major conclusions and key takeaways from the report. And before we get started, just a few housekeeping items. So after our panelists share their contributions, I'm going to be leading a Q&A session with questions that were sent in during registration. As always, if you have any additional questions for our panelists, please feel free to drop them in the Q&A box found at the bottom of your screen, and we're going to do our best to answer as many of them as we can within the time allotted. As always as well, we will provide a written answers for any questions that we don't have time to get to today live, along with a recording of the presentation slides, and access to the chat box discussion. All right, without further ado, you can go ahead and take it away, Kathleen. Thanks so much.
Wonderful. Thank you, Hannah. And thank you to you and the whole team at Population Connection. We're really delighted to be here today to talk with all of you about our recent report on population and climate change vulnerability. The report has had a really positive response so far, and I think that's in recognition of the fact that often there are folks who are interested in population issues and understand intuitively that there are relationships between population trends and climate change, and yet we don't often see that in discussions of action that we can take to address the climate challenge. So at the Population Institute, we wanted to take this opportunity to do a report that contains some analysis about what these relationships are and the potential ways that we can respond to what those relationships are as we're crafting action in the face of the climate crisis. So I'm going to share a little bit about the analytical work that we did in this report. And then I'm absolutely delighted that we have two of our report contributors who are doing work at the regional level that's looking at these relationships and really actively thinking about how to incorporate population considerations as well as gender equity, which we all understand is something that's really important in its connection to population trends, into climate change responses. So to get us kicked off, let me see here. First, I wanted to just take a step back to review a little bit about what it means to respond to the climate crisis. In my mind, and I think for a lot of folks who work in the climate change community, there are three very broad categories of action to respond to the climate crisis. One is mitigation, ways in which we as a society think about reducing the greenhouse gas emissions that are responsible for fueling climate change. A second area of action is adaptation. And that is the things that we do as human communities to be able to prepare for and respond to climate change impacts like extreme weather, drought, floods, heat, wildfires, sea level rise. All of these things that we have this summer felt in a very visceral way all over the world. But we know that these changes are baked in and that we will be experiencing climate change impacts for decades to come, regardless of what happens on the mitigation side. A third category is one that has emerged relatively recently, and that is loss and damage. And this is a category of action that relates to the changes that come with climate change, the impacts of climate change that we are not able to adapt to. So some of the irreversible losses and damages that are occurring, this is very front and center with some of the international negotiations on climate change and thinking about the ways that communities that have been irreversibly harmed by climate can be compensated really for the kinds of impacts that they have experienced. So I just wanted to go over that very quickly and to point out that this report really focuses on that adaptation piece and how do population trends intersect with our ability to adapt to the climate crisis. And in order to unpack that, we really had to think about vulnerability. Understanding vulnerability is key to planning for adaptation and what we need to do moving forward to be able to cope with the impacts of climate change. When we look at vulnerability, there are multiple components that have to do with the physical aspects of climate change, as well as the social and political ways we organize communities and nations to be able to move through climate change impacts. In this report, we use data from the Notre Dame Global Adaptation Initiative, otherwise known as NDGAIN. This is a research institution based at Notre Dame that tracks measures of vulnerability across three components. Exposure, which has to do with the physical dimensions of climate change and the communities that are simply exposed to those physical impacts. It looks at sensitivity, so how society is organized in relation to climate sensitive sectors, things like agriculture or water resources. And then a third element that's looked at when we measure vulnerability is adaptive capacity. And that has to do with things like financial resources that are available within communities, with the governance structures, the ways that communities organize themselves and can effectively plan and implement policies to be able to respond to climate change impacts. So NDGAIN creates an index that takes multiple indicators across these three categories, and then does a national ranking for all countries of the world, from the most vulnerable to the least vulnerable, based on their analysis of indicators across these three categories. And what we did in our report was to take a look at the 80 countries that were ranked most vulnerable. So the 80 most vulnerable countries in the world, and we put them in a data table in our report by their vulnerability ranking, and then analyzed population trends in those 80 countries, as well as gender equality at a gender equality index and reproductive health indicators to try to understand how these things were coming together, how they overlap with one another. And what we found in this analysis is that in the 80 most climate vulnerable countries, the average population growth rate is 1.8%, and that is about double the global rate. Now, 1.8% probably doesn't sound like a very fast rate of growth, but for those of us who understand and follow population trends, we probably recognize that 1.8% is kind of a rapid rate of growth. If it does not change, it would result in a doubling of population in less than 40 years. And when we're thinking about those three dimensions of climate change vulnerability, exposure, sensitivity, and adaptive capacity, we understand that population growth, rapid population growth, is something that has effects across all three of those dimensions. On the exposure end, in a very basic way, it means that more people will be exposed to climate change impacts. On the sensitivity end, we looked at the food security measures in these 80 countries and saw that in many of these countries, high proportions of the population are reliant on rain-fed agriculture. That is something that is a very climate-sensitive sector. And so population growth is something that can exacerbate food insecurity in these climate-vulnerable countries. And then on adaptive capacity, we understand the ways in which rapid population growth rate can strain the government's ability to provide basic services for a society that will be strained in the context of climate change. We also looked at measures of gender equity and reproductive health in these 80 countries, and we wanted to look at those because we understand that gender equity and reproductive health care are intimately linked to a rapid population growth rate in many places around the world. And what we found is that these indicators also lag far behind global goals. The Gender Inequality Index was one in particular that I think is really important to understand and unpack. The GII is an index that helps us understand how women and men fare in comparison to one another in a society. It is an index that goes from 0, in which men and women fare equally, to 1, which is really the worst possible equity between men and women. To give you a point of reference, in the United States, the Gender Inequality Index is 0.179, which means that we still have some progress to make in achieving true gender equality. But in the 80 most vulnerable countries, the average Gender Inequality Index was 0.521, which means that women and girls fare women and girls face a lot of challenges in achieving equality in many of the countries that are most vulnerable to the impacts of climate change. The reproductive health indicators that we looked at also demonstrate some severe gaps. Maternal mortality is much higher than the global average. The adolescent birth rate is much higher than the global average. And unmet need for family planning, which is this idea that women and birthing people would like to be able to either delay or end childbearing, but they're not using a form of contraception. This is something that really affects people in vulnerable countries much more than in the world on average. So we understood from this analysis that population growth, gender equity, and reproductive health care all connect in important ways, and yet we are seeing some challenges in terms of the extent to which these issues are incorporated into climate change challenges. Rapid population growth increases the exposure, exacerbates sensitivity, and limits adaptive capacity. Deep and persistent gender inequity deepens the vulnerability of women and girls, and it holds back their ability as leaders and agents of change in their communities. But in the face of all that, there is good news. There are strategies for adaptation that address these linked challenges. And that is what we really wanted to be able to convey in this report, is to document the ways in which these issues are connected, which can be a really gloomy story when you're looking at that data. But we also really wanted to focus on the hope here. And that is that there are strategies, these multi-sectoral strategies that can look at climate change adaptation and the needs that we have there and incorporate a consideration of population dynamics and the ways in which we can better meet the needs of women and girls in terms of gender equity, and especially in terms of their ability to manage their own reproductive lives that would have effects and to strengthen households and communities and individual empowerment today, as well as have effects on population trajectories in the long term, which can really strengthen the prospects for more resilient and just societies moving forward in the context of the climate crisis. So the next part of the report after this analytical piece was to focus on country profiles of 5 countries where there's really exciting, innovative, and impactful work being done at these intersections. So we focused on the United States, on Guatemala, Niger, Uganda, and the Philippines to be able to showcase that all over the world there are these really important initiatives taking place and that they are worthy of greater investment, of scale up, and of replication. So without further ado, I'm going to turn it over to Faith Bacon from the Philippines for her to be able to share a little bit about what her organization does at these intersections. Over to you, Faith.
Thank you. Thank you, Kathleen. And first, PATH Foundation Philippines, which is my organization, would like to thank, of course, Population Institute for including us in the report. Thank you very much. And also to Population Connection for making us join this webinar to share our work that we've been doing in the Philippines for a better part of 2 decades, actually, of almost more than 20 years. My organization, PATH Foundation Philippines, has been pioneering a strategy, as Kathleen has said, in the country, because the Philippines, as you would read in the report, is one of very vulnerable. We talk of vulnerability. We are very vulnerable. We are part of the Rim of Fire in Southeast Asia and the Asian Pacific. We are visited by typhoon almost every month in the country. We only have 2. There's a joke in the Philippines that there are 4 weather seasons. It's the wet, very wet, and dry, very dry. So there are just extreme weather patterns that are happening in the country right now, and it gets worse as climate changes. Next slide, please. Now, the strategy that we have been doing is called PHED. So what is PHED? We've been saying this for 20 years. It used to be PHE, now it's PED, and we have combined both to call it PHED. It's called Population Health, Environment, and Development. So what is PHED? Next slide, please. Well, as its name suggests, you can see that PHE and the D is a development approach that recognizes the interrelationship or interconnectedness or the dynamics between population, people's health, environment health, and development. In the Philippines, there is a Filipino word that we use for this. This is ugnayan. Ugnayan talks about synergy or connectedness, because the PHED approach creates synergy and value-added results when we put all this together, because it aims to meet both the reproductive health needs of a community while also developing environmentally sustainable livelihoods through natural resource management and biodiversity conservation. I'll give you examples of that in a while. In doing this, we put together the felt need of the community, which we believe would be the root causes of the problem, and building local capacity to address this. This would improve their commitment to address the barriers and the threats towards a healthy people and a healthy ecosystem. We firmly believe that there is a direct correlation between the health of people and the health of the planet and the environment. Now, PHED, as we have been doing it, is amenable to various sectors. It can be talking to our agricultural sector, to our education sector, to water, and water is becoming one of the main issues because of water stress now, clean energy and other development approach. And this can be applied towards improving human and ecosystem health. It supports cross-sectoral collaboration and coordination. Now, the difference and the highlight of PHED is it's being science-based. We produce the evidence, and we have been doing this for decades, of how PHE programs and projects implemented and pioneered in the country and have been scaled up in other countries show that PHE approach creates synergy and value-added results compared to single sectoral programs, because through simultaneous delivery of conservation, health, and reproductive health services with, and this is the highlight, community involvement. Next slide, please. Now, what are the PHE initiatives that we have worked with? We have been doing PHE since 2000. The first generation in initiatives around the PHE approach are the IPOPCORM and the PESCODEV strategy projects. I will discuss this later. After which there were replications and scaled up done, both within the country, and we were able to even go into global actions for this. And some of these initiatives have been replicated in other countries also. In the Philippines, we have also established a PHE network, which is a community of practice of population health and environment. And this has been also replicated in other countries. There is a PHE network now in Uganda and in Madagascar also. And these initiatives came from the Philippines, where we pioneered the PHE approach. Next slide, please. Now, let me go into each of these projects. And as you mentioned, as Kathleen has mentioned a while back, we were able to really go into implementing the approach. The first is what we call the IPOPCORM model. It's the Integrated Population and Coastal Management Initiative. It is described as the first or the initial project in the Philippines. It was implemented between 2000 to 2007 by PAT Foundation Philippines. We work in marine hotspots in the provinces of Palawan and Bohol. Palawan is the province that is nearest to the West Philippine Sea. And Bohol is where we have the Danahon Reef, which is a very big reef and a biodiverse area. And we work in 10 to 33 municipalities. The good thing about the IPOPCORM model was that it was considered a model intervention or a quasi-research, if you want to call that. We wanted to prove and to generate evidence about the integrated approach. Is it really better? Would it provide better results? So we identified 4 municipalities in the province of Palawan with the same profiles. One municipality, we implemented a coastal resource management only. In one area, we implemented FTRH project only. And one area, we did the integrated approach, and the other, we did nothing. We call it the placebo site. And we did that, the data gathering, we did the baseline, we did the data gathering for 7 years. And surprisingly, or not surprisingly at all, there were really actual output that were coming out of the IPOPCORM area or the integrated area, and the data coming out and the results were amazing, actually. Food security was the central theme. There were increase in family planning use in the area, and because of that, there were improved conservation and fishing practices. And there were reduced illegal fishing practices because these were the areas where there were a lot of illegal fishing practices being done and where there is depletion already of our fishes in this area. Household income were up also, and there were fewer households that are lacking for food. Next slide, please. So you see, based on strategy and research, we really were able to prove that the integrated approach really does work better than sectoral or single development approaches. Working on the results of the IPOP form, Path Foundation continued to implement another project called Balance. This is building actors and leaders for advancing community excellence in development. We implemented this in 2008 to 2015. This time, it's not only a Philippine project, but the area of focus were both Asia and Africa. We went global for this one, using the lessons learned and the positive inputs coming out of the IPOP Forum area. We were able to promote PHE models and approach with a wider audience. We were able to go into effective adaptation of the approach globally. As the slide would show us, there were 8 countries implementing PHE approaches by this time. We had 21 organizations using the tools and the protocols developed for the population health and environment programs. And we were able to increase access to FPRH, health, environment services in remote communities. Next slide, please. After that, Path Foundation had smaller projects in line with all of this. We would like to focus on the youth, so we had a youth empowerment project way back in 2000 also, where we targeted young people 15 to 24 years old to plan and implement integrated PHE approaches that promote self-help, improve quality of life, and enhance sustainability. This one they would do every weekend. The youth adopted an MPA, or what we call a marine protected area, in their barangays, and they would work on it every weekend. Now we call them our eco warriors. Next, please. And this one, the next project we implemented in 2021, this was at the height of the pandemic, was actually a gender-based project. This one, if you're interested, the design of this one and the details of this project is already published in the People Planet Connection site, and it's called our Connecting a Community Ecosystem to Family Planning and Reproductive Health, the Twin Bakaw Project. Bakaw for the Philippines is short for Bakawan. Bakawan is the local term for mangroves. So mangroves are Bakawan. So it's called Twin Bakaw because the project was designed in such a way that each newborn in the family will have a twin mangrove seedling, which the newborn's family must plant and nurture until it is fully grown. So every time a family in this community would have a new baby, they would have to plant a mangrove seedling. This we implemented in one of the richest biodiversity area in the country called the CIG. The CIG is the Calamianes Island Group. Palawan is just one of them. And this is the most biodiverse group of islands in the Philippines. Now, we were able to prove that, there is correlation between growing population and depletion of natural resources. Again, still continuously attributed to overfishing, illegal, unregulated, and unreported fishing practices. Now, this one, the women were the ones in charge of this project. The Bakawan, or the mangrove areas, were considered, or we were able to establish them as more protected area. Okay? And the women were the one who were able to make sure that these become protected areas. And they were the ones that were in charge of protecting and managing these protected areas. And they found a sense of belongingness to taking care of the environment through this practice. The women were the key contributing factors to both the environmental management and taking care also of the health of the community. Next, please. Finally, building on all the output and the victories of all successes of all this project of Path Foundation, we are now implementing a new project which we started 2 years ago. And this is called Building Capacity for Integrated Family Planning, Reproductive Health, and Population, Environment, and Development Action. We call this the BUILD project. This one, after all the evidences we have gathered of how the PHE and now the PHED approach works for communities, we would like to sustain the effort through policies. And the BUILD project is a policy communication project wherein we are working towards subnational, national, and regional, including global policies that we hope would increase the commitment of governments for cross-sectoral approaches to integrated PHE, climate change, resilience, food security, livelihoods, and security programs. In so doing, we would like to strengthen individual and institutional capacity of governments and government institutions and other stakeholders in advocacy and policy communications and negotiation. In doing so, when we put the policy there, we strongly believe that the PHE effort and all its successes and gains will be sustained throughout generations to come. And we hope that the PHE, as Kathleen mentioned a while ago, is considered an adaptation model that integrates population with health and development. Next slide. And finally, these are the key points that we learned through the years of implementing PHED, that these linkages are multidirectional, considering population, demographics, and change. And that the policy solutions, and this is what we have been working on, aims to change individual and institutional systems, structures, and behaviors that enhance technical capacity, including generating evidence and synthesis, and the tools that we have developed, and of course, putting in the financial resources to support cross-sectoral integrated PHED approaches are the institutional systems and structures and behaviors that we aim for, and that the related policies of PED or PHE or PHED should be always evidence-based and building on existing models. So with everything that we've been doing since 2000, with feedback and monitoring mechanisms. Thank you very much. Over to you, Kathleen. For Kelley, I think.
All right. Well, Faith, that was so wonderful. And I have to say, I have been trying here in the United States to figure out a way to bring PHE to our area. And I did a couple of focus groups with conservation biologists last year, and I showed them a vignette that I actually got from Population Connection years ago, I think that came from PAI, about it being done in other countries, and then asked how we could do it here. And, you know, working cross-sectorally is just hard regardless of what country you're in. But I still really have this desire because the same climate vulnerable areas in the United States are generally also contraceptive deserts and or now abortion deserts. You know, for example, the coastal global Southeast. And I think there's still really something there that we could learn in the United States from all the great work that others are doing around the country. So anyway, that was a small tangent, but thank you so much. And if anybody has ideas on how to bring those models to the US, I'm interested. Well, thanks Population Institute, Population Connection for the opportunity to be with you. My name is Kelley Dennings. My pronouns are she, her. For those that are unable to see me today, I'm a short, white, middle-aged woman with very short brown hair now. I just chopped it, standing in my office. I want to acknowledge that I'm on stolen Miccosukee, Timucua, and Seminole land, also considered Florida, where many individuals face displacement and suffering, and we really hope that one day they receive restorative measures. So I'm going to be sharing some information about a report we did, and I think Stephanie's going to provide a link to the full report in the chat, but it's called Gender in the Climate Crisis, Equitable Solutions for Climate Plans. So next slide.
So if you're not familiar with the Center, we're a national nonprofit conservation organization that works through a combination of science, the law, activism, and creative media to protect wildlife in the wild places they need to thrive. So you're seeing on the screen here all of our different programs. Next slide. So I'm sure many of you on this call today are familiar with Project Drawdown and how it lists education of women and girls and access to family planning as top climate change solutions. So we know, as Kathleen said, folks with more bodily autonomy to choose if and when to have children and more years of education often have fewer and healthier children and actively manage their health. Next slide. So this is a infographic we made for the report that I'm kind of overviewing. So we know that the effects of rising greenhouse gas emissions are more harmful to women, gender diverse people, and Black, Indigenous, and people of color, although these communities contribute less to climate change. So this really underscores the need to include gender frameworks and gender diverse voices from communities of color into climate planning. So next slide. So as I kind of mentioned in relationship to Faith's talk about working cross-sectorally and intersectionally, these quotes on the screen really show how our lives are not lived in silos. And so Chief Seattle said, all things are bound together and all things are connected. And, you know, Martin Luther King Jr. said, whatever affects one directly affects us all indirectly. So we really see these connections between gender justice and climate justice and reproductive justice and environmental justice. And these co-benefits of the solutions, as Kathleen mentioned, affects both people and the planet. So I sit in a lot of unique spaces. I'm an environmental group sitting on reproductive and family planning coalitions. And then, you know, I'm trying to get reproductive rights groups to understand the environmental impacts of reproductive health when we have poor environmental quality. Next slide. So the center sought to learn if gender frameworks were included in municipal climate plans. So this is one tool that we have in our toolbox in the United States. We reviewed 21 climate plans from cities across the country that you're seeing here. It was about 10% of the US population. So climate plans are detailed plans developed by an entity to outline the steps that we can use to combat the effects of climate change. And oftentimes they include both mitigation and adaptation. So, you know, we know that the pressure of population growth makes it harder to meet emission reduction targets while magnifying climate change's detrimental consequences on humans and other species. So while we see addressing population growth as a long-term mitigation strategy, there are short-term adaptation benefits that we can see from this work, which is how Kathleen kind of teed us up here at the beginning of the presentation. Next slide. So our analysis looked for gender-based empowerment solutions in municipal climate plans. And this has a lot of text on it, so please go to the report and you can read it more easily. But this was our attempt at defining gender empowerment. So we were looking at universal access to voluntary modern family planning, LGBTQIA inclusive, medically accurate, comprehensive sex ed, affordable and accessible sexual and reproductive health care, and then additional solutions like supporting educational opportunities, redefining gender roles, creating equitable opportunities for women, and guaranteeing safety from harassment and violence. So next slide. So unfortunately, none of the climate plans we reviewed mentioned family planning, contraception, reproductive health, and only one plan mentioned gender. And I will say the idea for this report came out of some meetings that I was attending pre-pandemic, where I would go to climate conferences and I would ask them if they were working on gender or family planning. And they were all very familiar with Project Drawdown, but nobody thought to include it in their work. So in addition to the 21 plans that we analyzed quantitatively, we did 7 informal interviews with sustainability professionals. And we identified the following themes that they kind of said to us, well, gender empowerment solutions can be difficult to measure. It's much easier to measure, the number of bus trips or, weather stripping and that kind of thing. They said that the need for government approval for a plan could be a barrier to including gender empowerment. So let's be honest, in this polarized United States right now, talking about contraception, much less abortion, could be really difficult at a local government meeting. They said, well, it matters who's at the table. Having diverse views represented in the discussion and decision-making throughout the development of a climate plan is critical. So when we were reading plans, if there was a health kind of track to it, we could tell that they had a public health professional probably at the table, where other ones probably didn't include anybody from health in their development of the plan. But they also felt that the pandemic was offering some opportunity for more inclusive climate plans. So next slide. So based on the literature and our qualitative and quantitative analysis, we recommend the following steps to be implemented. Again, this is kind of at the local government level, but work within those existing climate planning structures to address gender inequity as a public health issue. So make that connection. We need to start collecting this relevant data related to gender, race, and climate change. So a lot of times it is not broken out in that detail. We need to educate and train government staff on gender inclusion in the climate crisis. So even if you're not bringing those folks to the table, you can be the staff person representing those voices or attempting to. And we need to create gender advisory committees. Those would be great to bring to the table when you're building these plans. And then finally, next slide. We need to build gender empowerment programs that include offering comprehensive sex ed, supporting contraceptive access, keeping abortion legal, providing period products, funding quality education. I'm here in Florida, y'all. It's scary. And addressing racial inequity in schools. So we also need to be doing this programmatic work. And next slide. I just want to thank everybody. And, I will say that we are continuing this analysis. We're reviewing another 30 municipal plans. We're reviewing 25 university climate plans and also some state and federal plans. But if you are in a community and you get a notice that your community is writing or updating their climate plan, please reach out to me, because as an individual within that community, you could provide comments to them. We have been providing feedback to about 5 or 6 communities as they write and update their climate plans to try to include this language into them. So thank you. Please reach out if you have any questions or want to partner.
All right, thank you so much, Kelley, and thank you, Kathleen and Faith. Those were wonderful presentations, and it's so great to hear about the report and just about some of the major connections between climate vulnerability and gender equality throughout the world. I love the cross-sectoral analysis that's global in scope. I think often we look sort of internationally in terms of, what's going on with development and sustainability and things like that. But the United States is often also at risk in different ways, despite being a huge contributor to climate change. Some of the same sort of issues play out socioeconomically and in terms of inequality. So really amazing to get to hear from each of you. Thank you so much. I do have a few questions for each of you. The first is going to go to Faith. Faith, thank you so much again for speaking so beautifully about the programs that are being run throughout Path Foundation Philippines. You talked a lot about the ways in which gender equality is essential to sustainable development, but also to climate adaptation. In the report, there's a note saying that the UN Framework on Climate Change, the UNFCCC, has noted that if gender equality is realized and if women are able to become decision makers more within their communities, then that will have a direct impact on climate adaptation policies. I'm wondering if you could just touch a little bit more on that, like how within your experience with Path Foundation and in your programs has better gender equality translated, right? How has women becoming leaders within their communities and stewards of the land transformed paradigms and shifted perspectives in ways that will ultimately help build resilience?
Yeah, thank you for that, Hannah. I think the best example, as far as we are concerned, would be the Twin Bacau project that we did, wherein women really were the managers of the MPA, of the Marine Protected Area, and that they felt the empowerment really of being able to take control of both the environment, which actually was translated into the community, by making sure that reproductive health services were available to everyone in the community. The stories that were coming out of that project talks about simple things, but very empowering stories, like women going home and telling their husband, this is our site. We are managing it ourselves. Because in the Philippines and the coastal communities, the gender relations are really very skewed towards the men, because they are the fishermen. They are the ones that bring in the income for the family. They are the ones who are expected. So the women are just there to support. But in this case, when we were able to give them their own program and their project, and they felt an affinity to being the ones in charge and taking leadership, it was translated in how the gender relations at home changed for them, because now they were telling the husband, you have to stay at home because we have to go to the MPA, because we have to take care of this one, and this is for the community. And the husband felt that, and they gave way, and slowly, by little, the gender dynamics and the gender relations change. And we believe that is important. And Path Foundation had always been very clear about gender and its role, cross-cutting in all its program. And the reason why is because women, especially in the Philippines, I don't know, maybe, and we also see this in other low and medium income countries, women are really empowered if and only if you give them a chance to exert leadership in the community life. Okay, in the community life. And we believe that because women are also the greatest steward of both the family health, and we know that they take care of the family and their health, the children, and also their environment, their immediate environment. So we had to show them how their being leaders of their family health will also make them good leaders of the environment and the environment itself. And also because they are the most affected by all the climate crises that are happening also. Thank you.
Thank you. Yeah, it's great to see just and hear you explain why it's so important to raise the voices of marginalized groups within the context of climate change, recognizing that that's actually foundational to solving it at the community level. And it's so cool to see how climate change adaptation programs can be infused with women-led, women-trained programs that are simultaneously helping the environment adapt, and then also, changing sort of social dynamics and shifting paradigms towards a more equitable situation. It's amazing. Thank you. The next question is for Kathleen. Kathleen, you talked really beautifully about the sort of overarching global analysis of climate vulnerability and how it intersects with access to reproductive health and education and gender equality more broadly. And this report, I think, sort of joins a growing list of evidence supporting very obviously the fact that investments in empowering solutions like educating girls, better access to family planning, and so on are really foundational for, of course, expanding human rights, but also slowing population growth, reducing emissions, and helping people become protected from mounting climate impacts. And yet, as the report points out, there aren't many climate change adaptation plans that address demographic factors in preparing for climate change. And also, and perhaps even more importantly, there's huge funding gaps that remain in fully meeting unmet needs, especially with regards to family planning, but all across the board. So I'm wondering why you think it's so difficult to connect these dots, to connect these issues. And what do you think is the best way forward for closing these gaps? It's a big question, but
that is a big question. And I think all of our organizations are engaged in activities to try to connect those dots and to close those gaps. And we need to keep doing what we're doing. I think that by demonstrating the really great work that's being done by Path Foundation Philippines, that's being done by the Center for Biological Diversity, and by the other partners that were featured in our report, this is what it's going to take to keep advancing those stories, to show that it can be done, to show the success of this kind of integration. But we also need to continue to build the evidence base and do the advocacy work. And Hannah, you mentioned how funding for family planning programs has been stagnant for more than a decade here in the United States. As we're looking at our the budget and appropriations process for international family planning programs, for example, has been stagnant for more than a decade. And yet the numbers of people of reproductive age around the world is growing. We're seeing, inflation. The fact that this has been stagnant funding for more than a decade means it's actually been a huge cut, and that those services are going unmet for people around the world. So part of what we're trying to do is to show the ways in which that funding for family planning and reproductive health programs connects not only to the health and well-being and rights of individuals, but also has these wonderful ripple effects across sectors. So being able to have those conversations with people in other sectors to help do that education is really important. I think it's also incredibly important when it comes to climate change adaptation to have stakeholders at the table in these conversations. And I think both Faith and Kelley have touched on this point, that right now the world is thinking about how do we respond to climate change impacts. There is a lot of money and a lot of planning going into how we are going to respond. And a lot of the funding architecture is built on this idea that there needs to be stakeholder engagement in these processes as these plans are developed and as this funding is disseminated. So having stakeholder engagement is key. And I am so delighted that the Build Project is doing this work to try to really engage more folks from the health and reproductive health sectors to be stakeholders in these processes. I would love to see that happening more in the United States too. As Kelley talked about, we're not really great at doing that sort of multi-sectoral stuff here. But what it takes is for stakeholders to step up and ask for a seat at the table, to demand a seat at the table. And organizations like ours are here to support that, to provide data, evidence, techniques, ideas. Like, we really want to energize and mobilize that kind of stakeholder engagement when climate change adaptation plans are being put into place, because that's really what's going to steer what gets funded and how these projects are going to roll out over time. So I think those are two big areas that we need to have our eyes on: overall funding for reproductive health and family planning programs globally, and then really encouraging this stakeholder engagement from the health sector and the reproductive health sector in the climate change response efforts that are unfolding.
Wonderful. Thank you so much. That was a great and super comprehensive answer to a really complex question. So thank you. And just kind of related to that, Kelley, I'm wondering, just as a member of an organization that works largely, it's multi-sectoral, but you work largely in the environmental space. How do you respond to people who wonder why an environmental organization is talking about reproductive health and rights? Like, what's a normal response that you could give, or an idea for that you could give to us for how to better kind of fuse these issues together and clarify it for people?
I gotta say, I've been with the center 5 years now, and this is still sometimes a very difficult conversation and way to approach this with certain individuals and groups. But, one of the tenets that we really rely on is that we advocate for reproductive justice. And that definition is really key to what we work on. It's where everybody has the bodily autonomy to have children when and if they want, and to do so in a safe and healthy environment. So I can really make that connection. As Faith was saying, that, you know, we rely on our environment and our environment relies on us. And so again, human rights leads our work. And when governments invest in women and girls, our communities are healthier, democracies are more stable, economies are stronger, and, you know, we are a more resilient community. So that is just kind of, it's like people and planet thrive. It's good for both. And, you know, that we often say too, that these same oppressive systems that harm the environment are also harming communities and people. And so, you know, they're inextricably linked in our minds at the center.
Great. That's a great answer. Yeah, to just talk about reproductive justice as being the really complex and multidimensional concept that it is. It inherently includes the environment as well. We've got 1 more minute, and I just have a brief question for Kathleen. I'm going to try to keep it very brief, but all of this whole discussion is very important, obviously, and kind of touches on concepts and issues that aren't necessarily well understood or integrated into climate change action plans and discussions. And I'm wondering, you know, how does this conversation that we're talking about today relate to international climate change negotiations, especially those coming up in November at COP28? And like, how do you view the roles of like big international entities like the UN in helping to kind of clarify these connections? Oh, you're on mute.
Thank you for that question, Hannah. And I think this is a really great time to be thinking about it as we're heading this fall toward COP28 and a lot of other international convenings that are going to have climate change front and center. I think what's really exciting this year for COP28, and folks who are following it may know that health is going to be a big focus. They're going to have a whole day at the negotiations that's devoted to this concept of health and climate change connections. So this is a huge opportunity to bring reproductive health into that health conversation and to really bring this evidence forward about how these connections are so vital. In addition, there's so much growing interest around the gender dimensions of climate change responses at the international level. So under the UN Framework Convention on Climate Change, there is a gender action plan. I think there is a lot of momentum around understanding how empowering women and girls is something that is really impactful for thinking about addressing the climate crisis. We don't often see a lot of connection between the empowerment of women and girls to the ability for them to have reproductive autonomy in their lives. And this is something that we can continue to bring up, that really it's difficult for women and girls to have real empowerment in their lives if they don't have that ability to determine the number, timing, spacing of children, or whether they want to have children at all. That is so foundational. And we really need to continue to hammer away and do that level of education, because as we've all talked about today, there remains huge unmet needs for reproductive autonomy globally, with nearly 50% of pregnancies around the world are unintended. And that is something that we can and should be doing better to ensure that women and girls have access to the information, resources, and services that they need to really have reproductive autonomy in their lives.
Right. And it's so great that everybody's going to have this resource to reference going into these discussions. Thank you so much, all three of you, for joining us today. It's been such an interesting, fascinating, and important discussion. Thanks also to everyone who tuned in. There are a lot of questions that we didn't have time to answer, but stay tuned. We're going to provide written answers to them in the following days, and also stay tuned for a recording. Thank you so much, everyone, and have a great day. It was so wonderful to have you here.
Thank you, Hannah. Thank you, Kelley and Faith. Thanks, everyone, for tuning in.
Thank you.